Mind and body health. Over the past 20 years, scientists and experts have learned much about how our mind works and how it affects our health. Our thoughts and emotions play a major role in all aspects of health. Taking care of our psychological well-being can prevent medical illness and improve how we feel and function from day to day. In this presentation, we'll explore how to improve our mind and body health. To start, the human body has a very close connection to the mind and emotions, and it's tied to stress. As we have probably felt at some points in our lives, stress can have a negative impact on our health. How do you think that stress has affected your body? There are many levels of stress, and stress itself is not a bad thing. Stress helps us to have extra energy or stamina, but stress over longer periods of time can affect our bodies in a negative way. This can become a cycle based on what we give our attention to. If we focus on something stressful, our emotions are activated and it causes a release of harmful chemicals in our body. What do you focus on? Have you ever seen this cycle in your own life? Now let's consider ways to combat stress. What are things that have worked for you in the past to decrease stress? Some people like to use prayer or meditation or even breathing exercises. There are many ways and more than one right way to combat stress. The good news is that it is possible to gain control over the emotions that causes us stress. Abraham Lincoln once said, "Most folks are as happy as they make up their minds to be." What do you think about this quote? What does that mean to you? Do you disagree or do you agree? Now let's go on to the topic of mindfulness. This is a popular buzzword and it has many different forms. Simply stated, mindfulness is a term that focuses on what we give attention to. At any given moment, most of us are constantly thinking about something, and at many times it has to do with things that happened in the past or the future. From a positive perspective, have you ever noticed when you engage in an activity that requires your full concentration and is enjoyable that you experience an inward sense of pleasure that you can actually feel to some extent within the body? A bodily sense of pleasure, also thought of as bliss, often goes unnoticed or passes with little attention to it, but is very important. These present moment experiences can produce feelings of peace, contentment, joy, bliss, and they're all good to the mind and body connections that help our bodies to relax and function better. This is an example of natural mindfulness. Have you ever caught yourself saying, "What if?" or "if only"? How can you change that thought to be more aligned with your present circumstance? Try to avoid the what ifs or if onlys in life. By catching yourself and interrupting the thought with being aware of your present moment can lead to more mindfulness. An important component of improving mind and body health is compassionate self-awareness, or getting more in touch with our body, mind, and spirit. We do this through developing curious, non-judgmental attention to thoughts, bodily sensations, and spontaneous emotions, ideas, and inspirations. When you talk to yourself, is it compassionate? Would you talk to a close friend in that same way? Why don't we take a few minutes to practice a mindfulness activity? Let's begin by bringing our attention into your body. You can close your eyes if that's comfortable for you. You can notice your body seated wherever you're seated, feeling the weight of your body on the chair, on the floor. Take a few deep breaths. And as you take a deep breath, bring in more oxygen, enlivening the body. And as you exhale, have a sense of relaxing more deeply. You can notice your feet on the floor. Notice the sensations of your feet touching the floor, the weight and pressure, vibration, heat. You can notice your legs against the chair, pressure, pulsing, heaviness, lightness. Notice your back against the chair. Bring your attention into your stomach area. If your stomach is tense or tight, let it soften. Take a breath. Notice your hands. Are your hands tense or tight? See if you can allow them to soften. Notice your arms. Feel any sensation in your arms. Let your shoulders be softened. Notice your neck and throat. Allow them to be flexible. Relax. Soften your jaw. Let your face and facial muscles be soft. Then, notice your whole body. Take one more deep breath. Be aware of the whole body as the best as you can. Take a deep breath. And then when you're ready, you can open your eyes. So, how was that for you and your body? What did you learn about yourself? So we've mentioned the effects of stress. Sometimes it can show up as physical pain. Here's a video explaining the mind and body connection and how chronic pain can be lessened through psychological strategies such as mindfulness.
The late Dr. John E. Sarno is a pivotal figure in pain management. His controversial books on the psychological origins of chronic pain sold over 1 million copies, and he cured thousands of patients from chronic pain. This included celebrities such as Anne Bancroft, Larry David, and Howard Stern. Revered by some as a saint and dismissed by others, Dr. Sarno maintained that most non-traumatic instances of chronic pain, including back pain, gastrointestinal disorders, headaches, and fibromyalgia, are physical manifestations of deep-seated psychological anxieties. Dr. Sarno, who specialized in rehabilitation medicine, developed his theories over almost 50 years at New York University's School of Medicine. He gave the various forms of chronic pain the collective name tension myositis syndrome, or TMS, which, apart from its psychological roots, he attributed to mild oxygen deprivation caused by reduced blood flow to muscles and nerves throughout the body. He said most of his patients improved simply by learning and thinking about the psychosomatic connection to pain, and that others recovered by journaling regularly and in some cases doing psychotherapy. During his time in practice, Dr. Sarno conducted 2 follow-up surveys of his patients to gauge the effectiveness of his treatment approach. The first, conducted in 1982, selected 177 patients at random, of which 76% reported being pain-free. The second study was done in 1987 and focused on 109 patients who experienced back pain. In this survey, 88% reported being pain-free. Dr. David Schechter, who practices Sarno's techniques, also conducted similar follow-up surveys on his patients and reported a 57% success rate among 85 patients. In 2010, Dr. Howard Schubiner, who is the founder and director of the Mind-Body Medicine program at Providence Hospital, conducted a randomized controlled trial, or RCT, on the effectiveness of the TMS approach in treating fibromyalgia patients. This study was the first TMS-specific research study to use an RCT, the gold standard of the medical community. The study was conducted on 45 randomly chosen women who had fibromyalgia. The treatment consisted of just a one-time consultation followed by 3 weekly 2-hour group lecture sessions explaining TMS. After a 6-month follow-up, 46% of the participants reported a pain reduction of at least 30%. Since pioneering our understanding of the mind-body connection, many other scientists have gone on to develop a deeper understanding of how we need to take a more complete approach to chronic pain management, appreciating that chronic pain is the result of both biological and psychological factors. This is known as the biopsychosocial model, and it's how we treat those in pain through the Pathways program. If you're in chronic pain, download the Pathways app for free on the Apple App Store or Google Play.
What do you think about the video? Have you experienced anything similar to help relieve your pain? Mind-body wellness programs have an immediate effect and a lasting effect. They reduce stress in the moment and train the body to more easily and quickly relax. The more seniors practice, the more easily they can create a calm, relaxed state. Benefits of the mind and body wellness programs for seniors and everyone include decreased stress levels, reduced feelings of anxiety and depression, improved heart health, improved digestion and appetite, and overall mood improvement.